I've adapted over the years. Scap 7 does work very well with leukotape, but the same concept. The first time an overhead athlete's going to try to throw the ball or something, it's probably going to pop off the back, which is why kinesio tape tends to work better for this tape job as well. I think you have to really think of the joint. It's like shoulders, knees, they tend to get the most action with bending, so you have to think, is it going to pop off? And if you really think it will, then default into your kinesio tape. But what we're going to do here is we're going to identify, his scapula, and then what the whole goal here is to sort of help the scapula sit better on the trunk, okay, on the thoracic spine. And so what we're going to do here is I'm going to have him actually hold into a little bit of some external rotation. I'm going to take a smaller piece and I'm going to identify the spine of the scapula. It's probably right around here. And then we lay that piece down. And so direction when I'm putting this tape doesn't matter because this is just our lay down. It matters more when I put on his leukotape or his kinesio tape. And then we're going to try to trace down. There's the inferior border. Okay. Now, I could have made that a little longer, but what I don't want to do is cross his spine, right? Because the second he flexes through that, that's going to definitely pop off the back. So we sort of want to trace, and you can kind of see where his scapula is right now, right? Here's his inferior border. So I want to hug down on the border and just kind of support it, okay? And so what we're going to do then is we're just going to apply our top piece from lateral to medial. And what we're going to do, remember our unload, how we kind of pinch? I do the same thing here. We're just giving it a nice little pull across. Can you see kind of what that's doing to the scapula if I kind of pull it down just a little bit? So the concept is if the scapula is more anteriorly tipped, right, if I kind of grab it and give it a little tug, in theory, we can clear the shoulder elevation, right? Ultimately, when you have a scapular issue, whether it's dyskinesia, tipping, painful shoulder, whatever it is, you have to get to the root cause of why that painful shoulder is there, right? Whether it's a kinetic chain problem and the same side glute's not firing, or we just have trigger points, or whatever the issue is. But this may help in the moment getting an athlete to continue to play more safely, okay? Some people in the past have used this as a postural awareness for the scapula. I'm okay with that. As long as you're still doing the work, the neurorehab, the manual, the therex, the strengthening, whatever you have to do to really restore this shoulder complex, okay? So if there's trigger points here, you could tape all day and that's not going to change anything. So that's kind of how our Scap 7 looks. Now, be cautious when you flip sides that you don't do the 7 the same way, okay? Because it's going to be a reverse 7 now, okay? And then, again, though, this can be done in kinesio tape, okay? This might feel nicer for an athlete in kinesio tape. You would just have to make sure you watch the size of your tape because you saw how I pulled that a little bit. So you would need a shorter piece to accommodate for the stretch. Same thing here. You might want to, again, I had a little bit of room, but you might want to make that a little shorter to accommodate for that length, okay? But I will tell you that over the years, I've moved more away from this because I have my dry needling and I have my manual scapular work and my rib work and I don't want anything to block this. Now, if we've got a teenager who's going to school and then playing sports and they need a little postural awareness because they're like this all day in school, I'm totally fine with that. I think that's appropriate. In fact, you could probably do 2 on one side and the other side, but I would absolutely use kinesio tape because then you get 3 to 5 days out of it, right? This is going to last just the one time. This is as soon as they play and this is sweaty, it's going to loosen, it's going to pop off. Okay?